Africa Union Commission.
So moved. Comisarios de la Unión
Begin us off our session. Mr. President, the floor is yours.
Thank you very much, colleagues. Good evening. I guess my first duty is simple and straightforward. First is to recognize all of you present here. I do understand that President Maxo, President Senegal, may not be here, but he'll be joining us, who is also African Union President, our chairperson, so to say. Your Excellencies, heads of state and government that are here, Your Excellency, Mr. Mosa Faki Mahamati, chairperson of the African Commission, and Your Excellencies, heads of delegations, distinguished guests, ladies and gentlemen. So on behalf of we may make we pride ourselves on being a land-linked country. Before we don't complain anymore. We happily one neighbors. That is important. Africa. Very important. Many of our countries coordination structure.
discussion. His Excellency Musa Faki Mohammed of the Africa Union Commission to share with us his reflections and give us a keynote speech for today's side event.
Distinguished partners, ladies is guided by our Agenda 2033, which is one of the AU's key institutions that we rely upon to deliver on the vision of Agenda 2060. Healthy mind in a healthy body, isn't it? You will also recall, Your Excellencies, that the lesson we learned in preparing for and responding to disease threats on the continent led us to devise a new way for Africa to ensure our health security. And it calls upon all of us, member states and partners, to support the Africa Union and Africa CDC to fully implement that public health. This includes Africa Medicine Agency at the continental level. Two, strengthening our public professionals in every where they are investing in the local manufacture of all health products that we need, including diagnostics, therapeutics, and vaccines, to ensure that our supply chain for this life partner action-oriented any disease. Excellencies, ladies and gentlemen, pandemic is a major one of current public health over the last 2 years. Sadly, we have lost over 250,000 of our fellow citizens here in Africa to the COVID-19 pandemic. We must remember mothers, relatives, and friends. The number could have been higher if we did not.
Ya mikakati ya kiafya na majukumu haya yalifanywa na mawaziri wetu katika mwaka 2022 na
of economic growth and progress. It is therefore time that His Excellency convened us today here in Lusaka as key to the way that we prepare for and respond to health emergencies. They form the backbone of our early warning systems so that no outbreak will be allowed to spread and cause harm. An investment in these centers is a smart one. Evidence from many countries has shown that where we have these centers, and collectively align our approaches to strengthening our public health resilience, let us also make it an urgent agenda for our health security. Excellencies, ladies and gentlemen, the new Statute of Africa CDC, as adopted by the Executive Council during the just concluded session, has provided a strong basis for Africa CDC to expand support to our member states, to strengthen or establish public health emergency operation centers. I urge all African Union member states implementation of these centers as a critical however that we consider the light of the resources, financial, infrastructure, scientific, and others, of pooling our efforts and approaches. Indeed, working beneficial if regional centers catering for many countries in the region to maximize all our efforts and chances of success. Excellencies, ladies and gentlemen, I'm confident that the outcomes today will pave the way through concrete action for us to commit to strengthening our public health emergency operation centers in Africa. The Commission, through the Africa CDC, will support the implementation of the conclusions of this important meeting as part of our mandate in the new public health order. I thank you.
Thank you. Thank you very much, Your Excellency Musa Faki Mohammed, the chairperson of the Africa Union Commission, for that very robust message. And for those of us who are going to be responding to the agreements that are being made here today, we are glad to hear that the Commission is going to support these actions, and thank you very much. So, Your Excellency, as we wait for the arrival of His Excellency President Macky Sall, I would like to take this opportunity to make a short technical presentation to set the stage for the high-level policy discussion that is going to come after this. If we can have the presentation, please. Let me start by thanking the government and the people of Zambia for hosting one of the regional offices of the Africa CDC. The Southern Africa region office is here in Lusaka, and we have enjoyed a very good hosting, and we are looking forward to even better days into the future as we continue to serve our people in Africa. Next slide, please. Let me share just the structure of the messages that I would like to give today. It's divided into those 5 different steps. Next. And let me start by reflecting on the burden that Africa is carrying in terms of disease threats on the continent. We have the traditional diseases that we've had for a while, HIV, TB, malaria, and all the other tropical diseases that we see on the continent. These have been with us for quite a while. Then we have the emerging diseases, Ebola, one of them, monkeypox, that we've had for a while but has become very good, newsworthy stories these days are coming out because it is spreading outside of Africa. Marburg is here with us recently. But also we have the hidden epidemic of NCDs, non-communicable diseases, injuries, maternal and neonatal conditions. These come together, next, to give us a very huge burden that we don't see on a daily basis. Productivity loss annually we estimate at almost 800 billion on this continent. And this loss, we see it from direct effect on those who are suffering from the diseases and also from those around them who have to bear the burden of looking after those who are ill and the economic loss that we have to experience as a result of being sick, lost opportunities included. So our burden and the disease threats we face on the continent has a huge toll on the economic growth of this continent. When we look at the periods when documentation was effective on the continent, from around the 1950s, there is a very long journey that we have seen of emerging and re-emerging diseases here in Africa. Back in the 50s, we started seeing chikungunya. You will recall in the 80s when HIV, AIDS visited this continent, to the most recent COVID-19 that we are seeing globally, but with very heavy effects here in Africa. This journey tells us that there is more that is going to be coming, and we need to be learning lessons so that any emerging or re-emerging disease, we are going to respond to it faster and better, as His Excellency, the Chairperson of the Commission, has just shared with us. Next slide. We need also to have the reality of what we are facing. Bill Gates, 3 years ago, 5 years ago at the Munich conference, said something that we need to reflect on. That when we are looking at the possibility of millions of people losing their lives suddenly, it will not be war. Well, unless we use weapons of mass destruction, it will most probably be a highly infectious virus. This was said before the COVID-19 pandemic. I'm not saying it came to pass, but the reality is it is these very infectious pathogens that are easy to transmit that are going to be the biggest threat and not missiles or microbes. Stepping back and just reflecting on one aspect of the challenges we face on the continent. And if we picked only hemorrhagic fevers, these are fevers like Marburg and Ebola, we see that all these are African countries. They are too small for you to see, but what message there is here is that you see the red dots becoming more prominent as we get into the years over the last 2 decades or so. In the beginning, we were not documenting too well, but also these diseases were not so many. But in recent time, they have become more regular and they have been affecting more countries than we were seeing before. The threats are real and our response also needs to be real. Now, when we look at the priorities that we are designing as Africa CDC, next slide, we start from the guiding vision of this continent, and that is Agenda 2063. Aspiration 1, Goal 3 focuses on health and diseases. And this is what is guiding the work that we are doing. So implementing Agenda 2063 is a priority for Africa CDC. We want to contribute to this vision of our heads of state. Also, Africa CDC has been born and given responsibilities during a very pivotal moment on this continent. Free trade is being designed and right now is being rolled out. And when we trade, it means we are moving a lot of goods and people back and forth from one country to another. We have open skies, and this is a very important initiative of the Africa Union, where we want to be able to communicate with each other more easily, and travel becomes even simpler than it is now. Free movement of people. When we do these very important integration projects, we are moving more than just human beings. It means we are also going to open the door to move viruses, bacteria, and all other types of pathogens. So as Africa CDC, these opportunities to be able to move the continental agenda forward presents us with the challenge of ensuring that implementing these integration initiatives are done in a safe way. Public health has to play its role, and we are very honored as Africa CDC to be given that responsibility of ensuring that trade and free movement of people is done in a safe way on the continent. We are also guided by the Africa Health Strategy. This is one very beautiful document that is not very well known and not very well used on the continent, unfortunately. But it contains some very key areas that we, within the public health sector, need to focus on so that we ensure that Africa is safe. This is also a priority for us, implementing the Africa Health Strategy of 2016 to 2030. We are also guided by our second strategic plan. And this second strategic plan has been informed in a very large way by the experiences we've had with some of the very difficult health threats that we've faced over the last 5 years, including Ebola, Zika, and currently COVID-19. And we intend to make this strategic plan be implemented based on those lessons that we have learned over the last 5 years. Let me now shift to an aspect of the new public health order. The chair of the commission already elaborated these 5 different pillars of the new public health order. But today, I would like to focus on one pillar, and that is strengthening of public health institutions. We are convinced that in implementing the new public health order, we need to ensure that what we are doing at the continental level speaks the same language as what we are doing at the national level. This means that as we are strengthening Africa CDC as we are strengthening the Africa Medicines Agency and the Africa Union's Development Agency out at NEPAD, because all these continental agencies contribute to better public health. As we do that, we must make sure that our national level public health institutes are also being capacitated in the same way. And one key area of strengthening our public health institutions at the national level is ensuring that we have public health emergency operations centers. These centers are a very pivotal institutional capacity for effective and efficient health emergency management. Because if you have a center, then it means you are awake to any possibility of attack by viruses, bacteria, or other different pathogens at all times. You don't wait to act only when there is an emergency. You are already preparing even before an emergency comes. But why should we prioritize these public health emergency operation centers? It is because of the lessons that we have learned. Ebola taught us some very painful lessons. I will share a few. COVID is teaching us even more painful lessons. And we are putting all these lessons into use. And that is why we believe strongly that implementing public health emergency operation centers effectively at country level is going to make the big difference. So, which are the lessons that we've learned? Let's pick Ebola because we have gone through that, particularly in the Western Africa region, 2014 to 2016. I'm dividing these into 4 different phases, where phase 1 is the period just before an emergency hits. Phase 2 is the initial days of response. Phase 3 is longer term, and phase 4 is more the resilience part of the work that we do. So when you look at Ebola as an experience, one thing that was clear in the western part of Africa is that Ebola was there in the forest. And even within DRC, it is there in the forest, but it was not in the cities. But for the first time, the virus visited the cities in a very painful way. What we have learned is, one, we did not invest in the core capacity that you need for an early warning system, not at country level and not at continental level. Second lesson we learned for that first part of the Ebola response is that we did not monitor what we didn't know what we needed to have because we were not monitoring very well. We didn't have the capacity and we were not doing good monitoring. So it means that the gaps were establishing themselves and we were not addressing those gaps. In phase 2, which is really the beginning of the Ebola outbreak, we did not have mechanisms to capture good reports from the community. How many cases were getting infected? We didn't know, not too well. The public, did they know what they needed to do? That was not happening too well. And whatever capacity that we had was not enough to be able to pick the data, analyze it, and translate it into action. So we had a lot of insufficiency in as far as technical capacity is concerned. And when you have insufficient data, you respond slower. And indeed, it was months before the globe came together to try and address the Ebola crisis in Western Africa. Now, this slow mobilization is a direct result of weak capacities at country level. Now, when we look at the period of actual response, and this is the later part of 2014, we see that coordination was not effective. It came late. Unfortunately, there were so many partners trying to help, and each and every one had their own way of doing things. The governments had weak capacity to be able to coordinate, and therefore, all these uncoordinated efforts resulted in slower control of Ebola, the virus. Unfortunately, Your Excellencies, we also had the rather obvious to the mind, but not so obvious to action situation where a lot of the responders came from outside of Africa. They didn't know the language, they didn't know the communities, they didn't know the culture, and so they came with solutions, in quotes, that were not fit for those communities. And it's very gratifying to note that when the African Union sent African responders to West Africa, then the real traction of controlling that particular outbreak was felt. Because when the Africans went, they knew the culture much better, they could be able to relate with the communities much better, and therefore the messaging also improved. And the African Union, I think, needs to be commended for that particular effort. Now, looking beyond the Ebola outbreak, we see that there is need for better coordination for us to be able to arrest these processes quickly, and there's also need for better accountability for all those who are working on the continent, addressing different outbreaks, addressing different health challenges as we go along. And that is why we believe strongly that a public health operations center in the country, indeed several if you have a large country, is important for coordination of not just information, but also ensuring that resources are being directed to the right places. So why a public health operations center, we ask? It needs to support the public health response with good data that is analyzed quickly, and that analysis is then sent to policymakers to be able to make decisions that are relevant. We communicate with the public also fast because we know what we are dealing with, and we ensure that we are addressing our obligations towards the international health regulations so that information can not only help the country, but it can also help the neighbors and the globe in general. So when we look at a public health emergency operations center, essentially what it does is it manages incidents in a country. And the incident management structure that we need will require three big work areas. It gives us an opportunity to have a central source of information so that the whole country, the whole region, the whole continent is basing its planning and action on evidence. If you have too many multiple sources of information, you end up with rumors and you end up with uncoordinated action. Accountability is the second work area that is important. We need to know who is responsible for what, so that when things are going well, we praise the right person. And when things are not going well, we also sanction the right person. And this level of accountability is there in the incident management structure of a public health emergency operations center. And the proper chain of command means that decisions are made quickly. If information needs to stop at the center level, it stops there. If it needs to go all the way to the head of state, there is a clear path to follow so that decisions are made quickly and efficiently for the benefit of the public. So as I end, Excellencies, ladies and gentlemen, 4 essential elements that we need for a public health emergency operations center. The human being will always be required, so staffing is key. And this is one of the pillars of the new public health order, as I just explained. We need to have the correct staff being trained. We need to have the correct staff being deployed in the right places. And for a public health emergency operations center, we need those staff to be there throughout, so that when the problems are small, you have a small team to deal with it. If the problems are big, you then bring surge capacity. That is extra people who will come to handle the outbreak, and then they'll go back to their regular work. But the core staffing needs to be in place. Systems are required so that the structure is functioning in a smooth way. Infrastructure, not just the office, but also the equipment that they need, not only to look at data, but also equipment that they need to move around. Many times it is the first 2, 3, 4 days that are critical in emergency response. If those first 2, 3 days you don't do the right things, chances are you'll have an outbreak that you'll be dealing with for many months. But if you react well in the first few days, then chances are you'll arrest the outbreak and end up with a smaller crisis to deal with. Finally is data and information. How are you collecting data? How is it being analyzed? Where is it being transmitted and how fast? So that it can be able to result in very quick decisions being made. So when we look at the Public Health Emergency Operations Center situation in Africa, next, no, just back, yes. When you look at the situation on the continent, you will see that we have many countries at different stages of establishing public health emergency operation centers. But the ideal situation, we still don't have many countries having that on the continent. In fact, today, when we look at what is required of a public health emergency operation center, only about 12 countries have what we can say is an ideal situation of functionality and presence throughout the year. The rest will still require to work so that we reach where we are supposed to go. So in trying to ensure that we come out of 12 to more, we as Africa CDC have been working with many partners. Initially, Excellencies, 3 or so, 4 years ago, many partners were doing different things on their own. And because the mandate of Africa CDC and the Africa Union is to ensure coordination on the continent, we brought together many partners, some of whom are already here. The World Health Organization, the country representative is here with us. The US CDC, the Assistant Director traveled all the way from Atlanta to be with us here today. The UK Health Security Agency represented here as well. The European Center for Disease Control, ECDC, there, Robert Koch Institute of Germany, Bill and Melinda Gates Foundation, Resolve to Save Lives. We've been working together very effectively over the last 2 or so years, and that is how you see the numbers becoming very good in as far as ensuring preparedness for public health emergency operation centers is concerned. And we are very grateful, Your Excellencies, to the partners who have come through and worked with us over the last 2 or so years. Finally, is the way we see this going, Excellencies, is advocacy is essential. We need to ensure that our member states understand and appreciate the space that is going to be occupied by the Public Health Emergency Operations Center as one of building the capacity at country level. And when the capacity is built at country level, the continental capacity is also built. Second part of the reason we are here today is political commitment. And we thank you, Your Excellency President, for accepting to be the champion for cholera control, because this is one of those long-standing headaches on the continent. Cholera control is relatively simple, but it's very challenging when the information is not there and when the resources are also not there. And we have a political champion now that can be able to take the work that we are doing to the next level. So political commitment is key. Now, setting up regional support and continental support and coordination will ensure that the new public health order, as it is being implemented, we are benefiting from the resources that other countries have, the experiences that other countries have, the knowledge that exists within different communities. That coordination on the continent is very key. Fourth, Excellencies, is we need to have at least one functional public health emergency operation center in each country. Some countries can benefit from many such public health emergency operation centers because the country is large, complex, and has different types of outbreaks in different parts of the country. It makes it very easy when you have several of them. But at the very least, we are targeting that by 2026, we'll have 90% of the continent's member states covered in this way. And we also see it as very valuable, Excellencies, when we report back to our Africa Union policy organs, so that our leaders know what is going on the ground, and if we have challenges, we also share with them these challenges. Finally, Excellencies, is really a very big word of thank you to the Executive Council, to the Assembly of the Union, indeed to all our member states who, I wanted to say yesterday, Excellency Musa Faki, but I think it was today because it was past 1 or 12 midnight. So but to be diplomatically correct, it was yesterday. But a very big thank you, because the statute has been passed, the amended statute, and this gives us strength to be able to secure this continent even better. And we are looking forward to even more support from you as member states, from our partners, from the public in Africa, so that we can be able to achieve this goal of 90% by 2026 of public health emergency operation centers being in place here on the continent. I thank you very much for your attention, and let me take this opportunity, Your Excellency, of then, after all this technical mumbo jumbo that I have shared, if we can be able to hear from you your wisdom in your very keynote call to action motivation before we go into reflections from our member states. I thank you very much, Excellencies, for your attention.
Great. Thank you very much for that wonderful presentation. Very factual, very insightful. I believe we can give it another round of applause, please. Quite revealing, especially for a person like me who has agreed, and graciously so, consciously so, to be global cholera control champion at the political level. We got your message loud and clear. And I think this message is not meant for me alone, it's meant for my colleagues as well in the political leaderships, working with, absolutely. And I can confirm that you have our full commitment to this cause, which is so vital to the human race. Let me just say a couple of words to pick it up from where you left it. We have done the salutations already, so I'll go straight into the statement, really the motivation, so to say. Once more, I'm really honored to be before you today, this evening, and to invite you to this very important conversation, or to invite you to continue with this very important conversation. There's no better time to act than now. Having heard from the technical experts, the presentation we've just had, there's definitely no better time to act than now if we are to save lives going forward. The value we all have for the health and safety of our people must translate into embracing newer but better approaches of safeguarding our people's lives. No question about that. Public health emergency operations centers is one that aligns strongly with our intentions as governments on our continent, as a continent. And the efforts that we need to put in place for resiliency in public health systems so we can withstand emerging threats is vitally important, I argue. Public health emergency operations must be given the attention that they deserve. Not once, but all the time, as our way of life. Because we cannot have start-stop processes. No, it won't work like that. So we have seen, we have heard previous speakers expound on the importance and the value that working in this way brings to our health system resilience efforts. I urge us all to embrace this new paradigm shift for the good of the African people, and Africans cannot exist in isolation. We exist in the context of the global population. As we know, these pandemics know no boundaries at all. They do not understand that there are different governments around. They don't understand. All they know is that there are hosts that they would like to attack, and that's us in our individual countries, on our continent, and in our global community, global world. Indeed, it is clear that these actions are not good for just our millions of people who live in our countries, but for humanity as a whole. Your Excellencies, ladies and gentlemen, allow me to step back and substantiate why I'm making this call to action today. In 10,000 BC, you have heard me. In 10,000 BC, a deadly virus emerged in the Northeast African region, if you like, killing indiscriminately and causing a disease that time we did not know that early. But later on, we came to know and get to call it a name, and we called it smallpox. But that is after it had done so much damage to humanity. It did so much harm to us as humanity due to global migration. Smallpox arrived in China, as history tells us, by the 4th century, and in Europe in the 7th century, and continued to kill millions of our people until a coordinated global effort eradicated the disease. Only recently, in the context of history, 1977 is recent. Looking at the years, the centuries that it caused havoc to humanity. Now, with so much damage to lives, can we question now the importance of working in an organized way? Obviously not. The influenza pandemic in 1918 was the most severe pandemic in recorded history. That piece of history is also important to what we are discussing today. Very important. Caused by an avian virus, it infected an estimated, would you believe it, 33% of the entire world's population. So we are taught, with an estimated over 100 million deaths. That's a lot of people. Relatives, as my colleague said in his speech, relatives, mothers, aunties, friends, people we loved then, those who lived then. They loved so much, as we would do if we lived at that time. This is a hell lot of people, indeed. Although largely under control, we know, we understand, we appreciate that we're still battling influenza today. It has come once in a while. Recently, between 2014 and 2016, Africa witnessed the largest Ebola outbreak since the discovery of the virus in 1976. Nearly 30,000 of our people were infected, and over 11,000 of them lost their lives. There is no small number of people when we lose even 11,000. This is still still a big number. An estimated $2.2 billion was lost in the gross domestic product of the three countries that were most affected by this outbreak. The 2014-2016 Ebola outbreak prompted the head of state and government on our continent, on our African continent, to fast-track the establishment of Africa Centers for Disease Control and Prevention, what we in short call Africa CDC. This remains the most commendable move to this day by the governments that were in place at the time. And we thank them for that. Definitely, we thank them for that. 5 years down the line, the birth of Africa CDC has resulted in better coordinated and holistic public health measures against COVID-19, and indeed several other outbreaks across the continent. Just imagine if COVID came around and we didn't have Africa CDC. Just imagine for a moment how many people would have been afflicted, how many people would have lost their lives. Your guess is as good as mine. But we know that it would have been devastating, more than what we've experienced so far. The COVID-19 pandemic has had an all-time global impact, causing over 544 million cases. Over 6.3 million deaths so far have been recorded. And I must say here, we all know that this is the official record. I have no doubt in most of our countries, some people died without being recorded, and they died of COVID-19. I think we all agree. We all agree. Now, these are human lives lost. Add to the economic and social consequences, and this is estimated at $16 trillion, in addition to loss of lives. This is a huge cost. We all agree. The pandemic continues to take a toll on African lives and has pushed up to 40 million people into extreme poverty. Another cost that sometimes we hardly talk about: poverty. Imagine on our continent, Your Excellencies, colleagues, a continent that is already in poverty, now an additional number, 40 million. This is too much. This is way too much. The World Bank estimates that every month of delay in effective vaccine deployment, the costs in our continent move or gravitate upwards towards 13.8 billion of lost revenues. In contrast, faster vaccine deployment would accelerate the region's growth at a time where economic growth is low in our countries, most of our countries, for many reasons. But the fact is that growth is low. We could actually, by simply deploying vaccines faster, efficiently, effectively, we could see growth accelerate to 5.1%. Not next year, but this year, if we had done that. Now, 5.1% in monetary terms is a lot of money. It's a hell lot of money. Now, and this could go up to 5.4% in 2023 if we got containment measures working more effectively and spending what is necessary. Is there any more message or argument we need to make? The argument is very clear. There's no question about it. Your Excellencies, ladies and gentlemen, the International Health Regulations, IHR 2005, represent a legally binding global agreement adopted by all member states to build capacity, to prevent, to protect, and indeed to control disease. Legally binding. Comprehensive government approaches are therefore required for pandemic preparedness, particularly in our region, on our continent, where health systems are struggling in many ways, given the challenges that we face, even just to feed our people, before we talk of other health measures. We know that food is the first line of medicine to the human body. One of the core capacities for the IHR 2005 is for the countries to establish a functional public health emergency operation centers. There would be no excuse why a particular member country, Your Excellency, does not move in this direction. If we claim to take leadership to protect citizens, to look after citizens, this is one clear way we should do it. The argument is well made. The Public Health Emergency Operations Center serves as a hub for better coordination, preparation, response, and recovery for public health emergencies. A functional public health emergency operation is critical, therefore critical for the implementation of the International Health Regulations, IHR 2005, which, as we have said already, is binding to all of us. So I don't think there's any better matching order than this. It was done at our own instigation. It was done at our own realization of its necessity. And then we went ahead to effect it in terms of making it legal. So we can't go back and start making arguments that we went through already. We are at a different stage now. We are at a stage of implementing, if we haven't done so already. The focus by the Africa CDC to support member states have these functional public health emergency operating centers is therefore appropriate, especially in the light of increased risk of disease outbreaks and disasters across the continent and the world at large. This side event is thus called to heighten the call by Africa CDC to member states to ensure we establish functional centers in all our countries. It is my hope that this event brings to your attention, colleagues, excellencies, ladies and gentlemen, the need to fast-track needed in-country legislation and allocation of local funding, local resources to operationalize these centers. I'm proud to announce that we have done so here in Zambia, and we are working to increase allocation of resources as appropriate. As leaders gathered here, all of us, we owe it to our people and to the world. First, to our people in our countries, our regions, our Africa, and to the world to take appropriate measures against health emergencies, and so that We never have to be caught napping, to be caught unprepared again. Your Excellencies, ladies and gentlemen, allow me now to propose that we deliberate on how we can move as a continent to accelerate the establishment and strengthening, where these exist, of public health emergency operation centers on our continent. And the African Union, our African Union, is the platform, is the key unit, and indeed our health functional areas in our countries to help us achieve this. We know, we agree that we're aiming to achieve this goal as a continent, but we also know and understand that it's our hope for the African future. A safer Africa is what we need. A healthier Africa is essential. And importantly so, a prosperous Africa. But we can't be prosperous without being healthy. Not possible. It is also more important to accept that resilience in dealing with health threats is one of the minimums that are required from. This is needed more now than ever before. I thank you for your kind attention.
Thank you. Thank you very much, Your Excellency. Safer, healthier, and more prosperous Africa. I think that's a very clear message as we go into some reflections from the member state delegations that are here on that very clear call that His Excellency President Hakainde Hichilema has made. And I would like, with your permission, Your Excellencies, to request that we invite the member states present here today to make some brief reflections, considering the time, on this very important topic. And I would like to request that we begin. Ladies come first always, Your Excellency, so I would like to begin on my right with Her Excellency from Malawi, and then we'll go on to Egypt, and then to Mozambique and Rwanda for their reflections on your call to action. So, Your Excellency, from Malawi, you have the floor.
Your Excellency, President Hakainde Hichilema, President of the Republic of Zambia and champion for cholera control, Your Excellency Musa Faki Mahat, Chairperson of African Union, Dr. Ahmad Oguero Ouma, Africa CDC, Acting Director, and all protocols observed. Your Excellency, I bring you greetings from your brother, Dr. Lazarus Chakwera. He would have loved to be here, but due to other commitments, but he gave me greetings to bring to Your Excellency and to the government and people of Zambia. Your Excellency, indeed it's an obligation for countries to implement the international health regulations of 2005. And Malawi has made progress in strengthening our capacities to respond promptly and effectively to public health risks and public health emergencies of national and international consent. Malawi has established a public health directorate in the Ministry of Health in order to coordinate the implementation of the international health regulations, which call upon member states to strengthen their capacities to detect, verify, respond, and report public health emergencies of international concern. The Public Health Directorate is mandated to coordinate all international health regulations activities whilst bringing all public health emergency of international concern responders on board for effective and efficient response. Efforts are underway to establish a fully fledged institute which would be semi-autonomous so that it performs its functions more efficiently. Malawi reported the first confirmed cases of COVID-19 to WHO Africa within 24 hours of confirmation on 2nd April 2020. The wild poliovirus 1 was reported within 24 hours of receiving confirmation of the outbreak on 17th April 2022. This helped Malawi to receive international technical support within a week. Surrounding members were also able to prepare for their responses because they received communication in real time. Like all countries, Malawi has experienced a total of 4 COVID waves, and intra-action reviews were conducted for each wave experienced with coordination from the Public Health Emergency Operations Center. The Public Health Emergency Operations Center, which is housed in the Ministry of Health, spearheaded the response to COVID-19, and it continues to be a pillar in responding to all public health emergencies. Malawi has currently 3 incident management teams in the Public Health Emergency Operations Center, coordinating responses to COVID, polio, and cholera outbreaks. The center in Malawi is being used as a coordinating center where human, financial, and material resources are mobilized and distributed for emergencies under One Health approach. The center has assisted in ensuring that outbreak response calls for all responding sectors coming together to respond to public health emergencies. The center monitors the situation and advises government on how to institute further response to outbreaks. Like I said, Your Excellency, the government of Malawi intends to establish a National Public Health Institute in the near future so that efforts in responding to public health emergencies of both national and international concern are strengthened and public health scrutiny is assured. The government of Malawi, therefore, will ensure that the Public Health Institute of Malawi coordinates implementation of all international health regulation activities. And the government of Malawi will accelerate amendment of a piece of legislation that governs our public health. The government of Malawi will finally ensure that capacities are built to enable it to perform its functions in implementing the international health regulations under the One Health approach. Mr. President, can we question indeed that working together and coordinating is essential? No, we can't, Mr. President. I thank you for your attention.
Thank you very much, Honorable Minister. And Africa CDC stands ready to support Malawi to realize your dream of a National Public Health Institute. We will be available to provide that support. I would like to call upon Egypt.
شكرا جزيلا دكتور أوما. فخامة السيد الرئيس هاكيندي هيشيليما رئيس جمهورية زامبيا ورائد ملف مكافحة وباء الكوليرا، السيد موسى فقيه رئيس المفوضية، السيدة نائب رئيس المفوضية، السيدة المفوضة الصحة، السادة المفوضين، دكتور أوما، دعوني أولاً أعرب عن مزيد سعادتي لفخامتكم وجزيل الشكر على حسن الضيافة وحفاوة الاستقبال الذي لقيناها في زامبيا الجميلة. إنني وإذ أسمن الجهود التي بذلتمونها فخامتكم في مكافحة الكوليرا والتي نلمس أثارها في مناطق عديدة في القارة الآن، أود أن أعرب عن تقدير السيد الرئيس عبد الفتاح السيسي رئيس جمهورية مصر العربية شخصياً لفخامتكم، وتقدير مصر لدعواتكم الكريمة، وإلى عقد هذا الحدث الجانبي الهام عن مراكز الطوارئ الصحية والتي باتت أمراً لا غنى عنها من أجل التعامل البناء مع كافة تأثيرات وتبعات الجوائح. كما أود أن أعرب عن اعتذار السيد الرئيس عن عدم استطاعته الوجود معنا اليوم وغداً في القمة الهامة لقمة نصف المدة للاتحاد الإفريقي، لولا ظروف طارئة أعاقته عن المجيء ما كان ليفقد هذه الفرصة من التواجد مع فخامتكم. السيد الرئيس، أود أن أثمن رغبة مركز مكافحة الأمراض والأوبئة في الاتحاد الإفريقي أفريكا CDC في عقد هذا الحدث الهام كإحدى الدروس المستفادة من جائحة كوفيد-19، فضلاً عما لعبه المركز من دور هام في الاستجابة المنسقة لقارتنا تجاه الجائحة. لقد مرت على مصر سيدي الرئيس عدة جوائح مثل جائحة الإنفلونزا في 2009 والتي دفعت السلطات الصحية في مصر آنذاك إلى رفع كفاءة أنظمة الترصد والوبائي والكشف المبكر، وبصورة خاصة مراكز الصحة العامة وأقسام الطوارئ، فضلاً عن إنشاء فرق الاستجابة السريعة بجميع محافظات جمهورية مصر العربية لضمان الاستجابة السريعة والفعالة والمنسقة في حال وقوع أي وباء مستقبلي. وفي جائحة كوفيد-19 سيدي الرئيس، كانت مهمة مركز القيادة والتحكم في مصر والواقع بغرفة إدارة الأزمات في وزارة الصحة هو وضع سياسات للاحتواء وبروتوكولات للتعامل مع المرض الفتاك الخاص بكوفيد-19، كما كان من مهامه وضع الخطط التنفيذية والتنسيق بين كل أجهزة الدولة المعنية، بالإضافة إلى رصد الحالة الوبائية بشكل مستمر والتواصل مع اللجنة العليا لإدارة الجائحة لوضع وتنسيق الخطوات مع جميع أجهزة الدولة. وبعد استخلاص العديد من الدروس المستفادة، أود أن أوجه نظر الحضور إلى أهمية أن تضم مراكز عمليات طوارئ الصحة العامة في جميع الدول ما يلي: أولاً، منظومة إلكترونية لتتبع بلاغات الحالات المشتبه فيها، مروراً بإحالة المريض المشتبه بإصابته إلى مراكز الإحالة المعتمدة والتأكد من حجز الحالات وتلقيها الرعاية الصحية اللازمة بمستشفيات العزل المعتمدة. ثانياً، تدشين مراكز اتصال لاستيعاب بلاغات المواطنين، بالإضافة إلى إطلاق تطبيق لأجهزة المحمول وتقديم هذه الخدمات بلغات متعددة، وبحيث يكون دور مراكز الاتصال 3 يحتوي على 3 مكونات. أولاً الإحالة إلى منظومة تتبع بلاغات الحالات المشتبه بها. ثانياً نشر التوعية وإزالة كل الشكوك والمخاوف لدى المواطنين ومحاربة كل الشائعات، وقد عانينا منها سيدي الرئيس خلال انفجار جائحة كورونا في مصر. بالإضافة إلى تسبب هذه الشائعات في نشر الذعر بين المواطنين، وهو أيضاً ما عانينا منه خلال جائحة كورونا وما تبعها. الأمر الثالث هو تلقي الشكاوى والاقتراحات من المواطنين لتطوير الخدمات والتعامل مع الأزمات في حينها. ثالثاً اعتماد عدد من المستشفيات كمستشفيات عزل وإحالة على مستوى الدولة، يتم تحديثها طبقاً للحالة الوبائية، مع العمل على رفع كفاءة كافة مستشفيات الإحالة والعزل وتدريب الأطقم الطبية المتعاملة مع المرضى والذين يعانون من تلك الجوائح بموجب بروتوكولات التشخيص والعلاج المعتمدة، والحرص على توفير كل وسائل مكافحة العدوى للحفاظ على سلامة الأطقم الطبية. رابعاً اعتماد عدد من المعامل المركزية على مستوى الدولة لتلقي العينات من المصابين بالوباء، ورفع كفاءة هذه المعامل وتزويدها بأحدث الأجهزة الخاصة بالتشخيص، بحيث تكون هذه الأجهزة تستطيع أن تتعامل مع التشخيص الدقيق والتحليل المفصل لتلك العينات، مع إنشاء منظومة إلكترونية للتنسيق لضمان سرعة ودقة الإبلاغ عن الحالات الإيجابية بشكل مركزي. خامساً تحديث سياسات الحجر الصحي للسيطرة على المنافذ الجوية والبرية والبحرية للدولة، ورفع كفاءة نقاط الحجر الصحي على الحدود وبهذه المنافذ، وتزويدها بأحدث الأجهزة الطبية في التشخيص السريع والدقيق للحالات، مع المتابعة الدقيقة لهذه النقاط وربطها بالمنظومة الإلكترونية للتنسيق. وختاماً سيدي الرئيس، أود أن أؤكد على دعم مصر الكامل لتبادل الخبرات الفنية مع الشقيقات والأشقاء الأفارقة لتعزيز شراكتنا الاستراتيجية عبر القنوات الثنائية أو عن طريق مركز الأفريكا CDC وجميع اللجان والهيئات الخاصة بالاتحاد الإفريقي وآلياته، إيماناً منا بالعمل المشترك الذي ترسخ في ظل جائحة فيروس كورونا المستجد، والتي علها تكون جائحة نخرج منها بدرس مستفاد وبعبرة لنا نتكامل معها اجتماعياً واقتصادياً وصحياً ونصبح القارة التي نتمناها. شكراً سيدي الرئيس.
Thank you. Thank you very much, Egypt, for sharing those experiences, including areas that we need to include in our public health emergency operation centers. I've seen my colleagues writing furiously, so I'm sure that is going to be added to the package of support as we complete it. And we will take up Egypt on the offer of solidarity by sharing of experience as you have indicated. Your Excellency, finally, I would like to call on Rwanda to give their reflections before we'll come back to you for some closing remarks. Rwanda, you have the floor.
Your Excellency, President Hakainde Chilema, Your Excellency, the Chairperson of the African Union Commission, Your Excellencies, First of all, I would like to present the apologies of His Excellency President Paul Kagame, who could not be here for this event due to prior and important commitments, and also use the same opportunity to convey his greetings. I wish also to commend the African Union Commission and the Africa CDC for this important initiative for the health of our populations. The establishment and the strengthening of public health emergency operations centers on the African continent is long overdue, considering the health threats on our population and the human and financial costs associated with uncoordinated responses to epidemics. Rwanda congratulates His Excellency Hakainde Hichilema for championing this initiative and happily join the call to action for strengthening public health emergency operation centers in Africa, and Rwanda stands ready to contribute to these efforts to control epidemics on our continent and provide appropriate responses, and also work towards preventing these epidemics to happen. I thank you for your kind attention.
Thank you. Thank you very much, Rwanda, for joining the call, and we are looking forward to working with Rwanda to strengthen public health emergency operation centers. Your Excellency, President Hakainde Hichilema, I would like to now bring it back to you. You had the reflections from the member states, and I would like to assure you that with our partners from the technical side, we are very ready to act based on the guidance that we are provided by our member states. And as the champion for cholera control and the host of this particular event, I give it back to you for the call to action. Mr. President.
Moderator, thank you very much. And just to thank all our colleagues that have spoken, the countries, obviously representing the rest of us, the rest of the countries that have not spoken, and to also thank the Commission, the EU Commission, for all the hard work behind the scenes. And I think we've come at a stage where we have to confirm what appears to be consensus. I don't see any objections to this critical development on our continent, which will contribute to the global, if you like, enhancement of our health service delivery and protecting lives, the dear lives that we save in different capacities. Commission and moderator, I believe this is a time for us to summarize by basically calling out ourselves to action. So let me summarize it. Let me run through it on behalf of all of you, that this is the Lusaka call to action, strengthening public health emergency operations centers in Africa. And I repeat, a call to action. On the sidelines of the 41st Ordinary Session of the Executive Council of the African Union, and the 4th Mid-Year Coordination Meeting, MYCM, of the AU and the Regional Economic Communities, RECs, in Lusaka, Zambia, today, the 16th of July 2022. We, the heads of state and government and leaders of the delegations, hereby starting by recalling the heads of state and government's declaration on the 4th of July 2017 on accelerating implementation of the international health regulations in Africa, which seeks to address the increasing public health events and the recurrent epidemics on the continent and to prevent, protect against, obviously, control and provide public health response to the international spread of diseases. Deeply concerned about the increasing number of public health events and the recurrent epidemics, including the COVID-19 pandemic on the continent. Further concerned by the enormous social economic impact of these public health emergencies, noting the inadequate implementation of the International Health Regulations, IHR, cognizant of the fact that disease threats, epidemics, public health emergencies, and pandemics are a social, economic, and security threat for the continent, and therefore pose a huge risk to the achievement of the Continental Aspiration Agenda 2063, the Africa we want. Noting the duty and political mandate of ministries of health and national public health institutes, NPHIS, to prepare for and respond to public health emergencies and establishment of strong, resilient, and adaptive health systems with effective coordination, collaboration, and sharing of information and other resources. Cognizant of the fact that a Public Health Emergency Operations Center, PHEOC, is a critical element for coordinating critical life-saving data, information, and resources that help member states to prepare better for and respond effectively and efficiently to public health emergencies. Mindful of the fact that African Union member states are at different stages of establishment of national functional PHEOCs to fulfill the International Health Regulations, IHR, commitments. Take note of the close collaborations and the efforts being made by the African Union Commission. Thank you for that. Africa CDC, WHO, and all partners in establishment and strengthening of PHEOC's capacities in Africa. Hereby make the following Lusaka call to action. We urges all African Union member states and partners to recognize and prioritize PHEOCs as an important pillar in health emergency preparedness and indeed response. Call upon all African Union member states to make a commitment to establish and or strengthen functional PHEOCs in each African Union member state. Call upon all AU member states, African Union Commission, Africa CDC, all partners and global leaders to join us in, first, accelerating the establishment and or strengthening of national functional PHEOCs and the Ministries of Health or National Public Health Institutes in all AU member states by 2026. Second, ensuring that African Union member states develop clear PHEOCs roadmaps, and PHEOCs are entrusted with the legal mandates, equipped with the right infrastructure, human, and indeed financial resources. Third, prioritizing mobilization of resources necessary for accelerated implementation of national PHEOCs roadmaps in line with Africa's new public health order. Fourth, and before four, Further call upon the African Union Commission and Africa CDC to put in place a continental mechanism and structure to coordinate the accelerated establishment, strengthening, as the case may be, of the PHEOCs in Africa and collaborate with all relevant stakeholders. Further, to inform AU policy organs of the progress made in implementing this call to action annually until 2026. The Lusaka call to action declared on this 16th day of July 2022, of course in Lusaka, Zambia. Thank you.
Thank you. Thank you, Your Excellency, President Hakainde Hichilema, for that very clear call to action. And I would like to call upon my colleagues in Africa CDC and the Africa Union Commission and our partners that even as we go for a meal tonight, there's very clear roadmap for what we should be doing. And knowing the President, he will be asking us to report back soon. So please let us begin early. That way we have some results to show when we are called upon to report back. Your Excellency, I would like to really respectfully call upon you for your closing remarks so that we may be able to close this, the side event and move on to the next part of the evening, which we hope is going to be a lot more casual, as it were, than this formality that we have here. Mr. President, back to you.
Thank you, Moderator. Once more, protocols, respected Commission Chair here and your team, to really thank you for the work that you've done, Africa CDC, our partners, and delegates to this meeting, this part of these AU meetings, if I may generally define them like that, for your contributions. And obviously, I repeat, the work behind the scenes to bring us this far means we've done quite a lot of work, not just yesterday or today and today, so to say, but well ahead, well before today's meeting. So thank you so much. I do believe that when we make a commitment like this, we make the commitments with our eyes open, our ears open, and that we will carry through this call to action so we can be of relevance to our populations in our countries, to our people on our continent, and invariably, as I said earlier on, Moderator and Commission here, that pandemics recognize no territorial boundaries. Therefore, it's important that we work speedily, and we in the political leadership, I believe I speak for the rest of my colleagues, are committed to providing support and the leadership that is required to effectively implement and operationalize these centers so we can be more effective in future. I want to remind the meeting here, just imagine if the coronavirus broke out before the Africa CDC position. It would have been dreadful. We would have been talking about more infections than we had, would have been talking about more loss of lives. So thank you very much to all for staying and enduring a number of hours to get us to where we are. And I'm grateful that we have achieved consensus around this issue. And let's go out and do some work. Thank you very much.